Right, Dr. Henderson, welcome to the Easy Conversations podcast. Thank you for joining me today. I'm really looking forward to our conversation. We've been able to touch offline, but there's a lot of interest in this infrared light therapy, and we'll obviously talk about all the benefits here. I've started using it personally, and I was told they also have it at the yoga studio I go to. So it's a lot of and to your point, as you mentioned to me earlier, it is revolutionary in that regard. But there's also a lot of interest for me personally in terms of the research you're doing, and more so from a therapeutic standpoint. So I would like to jump into all of that. So before we get started, I do want to give you an opportunity to share with the listeners a little bit about yourself, what's brought you here, and who you are.
Okay. All right. Well, first, Furkan, thank you for having me on the show. It's my pleasure, and I really look forward to educating your listeners about infrared light therapy, and really truly as a revolutionary new modality in medicine.
Mm.
And it's a good question of how did I end up here?
Yeah.
I mean, quite literally, I started life as a musician, and I was, you know, spending all of my time playing. I was in jazz, I was in symphonic orchestras, et cetera, et cetera. And really didn't pay attention to the rest of the world. Science, I just avoided. But when I discovered science in college, it opened up a whole new world for me. And I became fascinated by not just how science works, but how science is broken.
Mhm.
And one of the fundamental books I read was Thomas Kuhn's The Structure of Scientific Revolution. And this is where the word paradigm shift comes from. And I that became my Bible. The idea that science only grows by breaking its current paradigm or its current way of thinking and growing beyond that. And so I ended up going to medical school, and then took time out of medical school to a PhD, graduate school for 4 years self. And so that brought me into growth factors and neuroplasticity and all of those types of concepts. And I ended up in radiology for about a year. And then spec scan, I'd sit down with them and say, look, the scan shows that you have a traumatic brain injury.
Yeah.
Infrared light? I mean, how does it even get through the skull and reach the brain? This is ridiculous. What a bunch of nonsense. So I pushed off initially. I said, no, no, no. Read the studies out of Harvard. So I started reading the studies out of Harvard, and sure enough, this is incredible.
Mm.
And so that's how I got to this place. We now have 2 patents on different ways of delivering infrared light. I have other patents on other things we won't get into. But what we did, and this is the late Dr. Larry Maurice, who was my colleague, we went into the lab and we said, how do we grow what works in the mouse so that it works in humans? Because the early clinical trials failed. Bone and muscle and sinew. And we were able to show that, yes, indeed, exactly the same amount of energy delivered here will deliver the correct amount of energy on the other side.
Mhm.
And we did a number of studies like that, working with cadavers, working with cadaver skin, and really nailed down how much energy you needed to get through the scalp and skull and into the brain. Because you need to deliver the correct amount of energy, not too much, not too little, to the neurons of the brain in order to actually make these big changes. That's a story.
Yeah, yeah, I appreciate that. Thank you. And I do see a bit of an overlap there, right? Like even in music, there is a lot of complexity, and you have to bring about order from whatever the chaos might be. So I see a lot of overlap in terms of, so I can see why you were naturally gravitating towards this line of work. So it is very fascinating. Now, you did touch on it, so I am curious because there's a lot of red light therapy has gained prominence, and obviously we'll get into some of the PTSD side of things and the traumatic brain injuries for sure. But in the media, and I guess more so, it's become a trend in terms of benefits it has for your skin.
Mhm.
So you touched on the energy and the intensity there. So how do you differentiate between the level of energy and intensity one has to expose themselves to where it does penetrate the scalp and starts benefiting your brain versus some of the more common forms of therapy out there, whether you're going to a spa or something,
Mhm.
but a bit of a light setup at home, that's probably not enough. But I'm just curious to understand how do you differentiate the exposure level there?
Yeah, I'm going to break it into a couple of segments. The first is to understand infrared light just in general.
Yeah.
It's a lot of different wavelengths are categorized within infrared light. And then you've got, the upper end of the visible spectrum, red light, and that, also has some, just understanding there's a whole deliver the wavelengths that are going to activate the mitochondria within cells. Mitochondria are those little organelles that make energy. Now, neurons, if you think about the job of the job of a neuron is to create electricity. It produces the currency of energy for the body, let's put it that way. And two of those enzymes contain copper. Just like our hemoglobin in our blood contains iron, and that iron facilitates the transfer of oxygen on and off the hemoglobin. The copper is vital to make that electron transport chain work and to produce energy. Now, infrared light of certain wavelengths will activate that copper. So there are these key wavelengths right around 800 and up to about 1,000 nanometers, which activate the mitochondria. And so if you are truly interested in directly treating neurons, then that light has to reach the mitochondria within the neurons. So it's got to get through scalp and skull. And, my skull being thicker than most, we have to, have enough energy to get through that. And the distinction between low power infrared light devices, these things that you can buy on Amazon or you can get, I could name it several different manufacturers, but I won't. The helmets and
Right.
the little metal contraptions with the little pads and, the neoprene pads with a bunch of lights on them.
Mhm.
Those are delivering half a watt. Now, half a watt will go about 0.8 millimeters, a hair's breadth into the skin. So it's great for treating the skin. You want to grow hair? Put one of those things on your head. You'll grow hair.
Mm.
If you want to, make your strengthen the collagen and build up the elastin in your skin, this will do it safely. But it's not going to reach the brain. So we'll come back to that piece in
Yeah.
just a moment. So I wanted to, when you look at this whole spectrum of red light as it's being talked about, these chambers you can crawl in, these at-home devices you can put on your head or on your back or your knee, wrap it around your knee, whatever. These are delivering energy to the skin, not to the joint, not to the muscles, not to the brain, just to the skin.
So that helps me understand, and I think it's important to recognize. So then I guess one of the things of what I'm hearing here is then as a individual who's looking for the exposure, it's important to understand the wavelength that you're
Mhm.
and the manufacturer may or may not provide that, right? So I think there's a level of due diligence that needs to
Generally, they do. Generally, they
happen.
do. Yeah.
Okay. Okay. No, that's good. So let's get into the research and then we'll talk about the exposure to the
Mhm.
brain. What are the questions that I have typically when anything research related comes up is you've talked about the clinical trials. So there's the whole idea of sample size, and then are you able to reliably replicate that in different scenarios? Where's the validity? Are you able
Mhm.
to speak about that with respect to the research you've done? And obviously, you have had to prove that concept in order to get
Mhm.
patents pending as well, right? So,
Correct. Correct.
yeah.
Yes. Talk about the studies that have been done, and so most of the studies that have been done that have autism, PTSD, there's been a couple of studies. Traumatic brain injury, there's been 4 studies, depression, 2 studies. Anxiety was lumped in with the depression studies. Dementia and mild cognitive impairment have been looked at. Parkinson's has been looked at with these low power devices. And here's the bottom line. Pick any study whatsoever, they will see a small clinical benefit. The kids with autism are a little less atypical. The people with depression are a little less depressed. The people with mild cognitive impairment get a little improvement in their cognitive function. But as soon as the study ends and they stop getting the daily light treatments, all the benefit goes away. So it's a small benefit and it's transient. Now contrast that with the work that I've done. And I'm the first to say I have no double-blind placebo-controlled clinical trial at this point. Harvard, Mass General, and I are submitting a grant together to look at exactly that question. And it's an exciting study because we're going to compare high power, the multi-watt therapy that I use, versus the low power in a clinical sample of veterans and civilians with traumatic brain injury. So that's coming. But let's talk about what I do know from the open case series and the hundreds of patients I've treated. The multi-watt infrared light therapy that we use has a profound benefit. So, if we just look at traumatic brain injury for a second, everyone with a traumatic brain injury has sleep problems. And in study, the response rate for the antidepressant effects of multi-watt infrared light was 93%. The P, that is, how accurate this is, was 6.02 times 10 to the minus 13.
Yeah.
So the chance that we were wrong was very, 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 very small. Now, the depression study using the low power devices, this was done by Paulo Cassano at Harvard, had about a 35 to 40% response rate, and the P was just below 0.05, it was 0.43.
Yeah.
So not a huge benefit. And he's the first to admit that, once they stopped getting treated, the benefit went away. We're in this situation, and this is the challenge that I'm putting out there, is we have to be cautious about what we say about infrared light therapy. These low power devices that you can safely use at home provide a benefit.
Yeah.
It's doing something. I'll explain later what I think it's doing, but it's doing something, and there's some clinical benefit, but as soon as you stop, it goes away. And our patients, our traumatic brain injury patients, we first published on those in 2015. We're now 2024. We're still in contact with them. They are still doing great. Our depression patients, not depression, we're not changing the gene. So some of those patients became depressed again. 70% of them were now 8 years out. They're doing fine.
Yeah. So let's maybe jump into that then. So let's talk about what the low powered energy is helping with in the brain. And then I do want to shift back to some of the longer term effects you're seeing with the work you're doing and why is that. So let's focus on at the minimal, the lower powered, what's happening there.
And there's a whole host of studies. I'll just give you one that he did that I thought was so clever. So there's a toxin, MPTP. If you inject it into an animal or a human, it kills like 90% of the dopamine neurons in the part of the brain that regulates or prevents Parkinson's disease. So you basically create a model of Parkinson's because you lose all these dopaminergic neurons. So what he did is he put this little aluminum foil hood over the mouse, and he irradiated the back of the mouse along the spine one time. He did this to a bunch. And then he took two groups, one that had been irradiated on their back and the other that hadn't gotten any treatment, injected them all with MPTP. The ones who weren't treated, 90% of those dopamine neurons in the area called the substantia nigra, to be precise, were gone. In the animals that got a treatment on their back, not to their head, but to their back, only 50% of the neurons were lost. It was neuroprotective. So indirect photobiomodulation. So I think that's what's really going on with these low power devices. So we did an experiment And again, this is a preliminary experiment. We did it with, my staff. So 10 of us all volunteered. And we were modeling a study that was done by Gonzalez Lima. He's down at the University of Texas, San Antonio. And he's been working with 1,064 nanometer light. And you shine 1,064 nanometer light on the forehead of people, and they see cognitive improvement.
Mm.
They get smarter on psychological tests. If you are measuring QEEG and you put 1064 nanometer light on their forehead, alpha waves in the brain go up. So we decided to model that experiment. We set up our QEEG and we irradiated the forearm because it's a little painful. I put a blood pressure cuff on my arm, pumped it up till it basically cut off blood flow, creating a tourniquet. And the alpha waves in the brain shot up. So whatever we had released in the forearm, in the skin of the forearm, was trapped there in the blood. And as soon as we released it, it went to the brain. And frankly, it goes to the entire body. So if you have one of these infrared light devices, a pad with a bunch of lights on it or a helmet, you don't have to stick it on your head.
Yeah.
Stick it on your chest. And I'll tell you why you want to do that with the helmet. And here's the piece de resistance that most of the field misses. Hair blocks infrared light. And we showed this. We showed that 95% of the energy of infrared light was blocked by 3 millimeters of hair.
Mm.
So hair blocks that infrared light in that helmet from actually even reaching the skin. So don't stick the helmet on your head, stick it on your belly. Mm. Stick your arm in there, something, but don't stick it on your hair.
Yeah. Is that because the thickness of the hair is interfering with the penetration? The light
hair acts like a hall of mirrors for infrared light. It gets inside the follicle and just bounces around inside the shaft of the hair.
Yeah. Okay. Yeah. So what I'm hearing there is even the exposure, if you're looking just for the improvement in the skin, is having an indirect positive benefit for your brain too. And to sustain that benefit, you need that continual exposure, as you mentioned in the studies. When that exposure was cut off, then the benefits started to wear off too.
Mm-hmm.
Okay,
exactly right.
Then let's maybe talk about the studies you've been doing and help us understand the benefits, how they're materializing for depression and PTSD. And I know you've touched a little bit on the benefits that the exposure can have to the neurons, but let's tie it all together. And then how is it sustaining itself over the long term?
Yeah. So let's talk about depression and PTSD.
Sure.
So one of the things we've known since shortly after they invented the MRI is that in people who are depressed, the deep in the temporal lobes and the frontal cortex gets smaller. So there is neurodegeneration to PTSD and depression and probably other things. So when you think about treating depression, and you go and you get Prozac and you take Prozac for 6 weeks and, it's increasing that serotonin and that'll make me feel better. Poppycock. That's been disproven. The relationship between serotonin and depression has been disproven. And here's the funny thing, Prozac actually increases serotonin within a couple of hours of taking it. And that's why it's used for PMDD or PMS. You don't have to take it all month long. You just take it for 3 days before your menstrual period the brain continue to work when it's being onslaughted by these hormones. Take 6 weeks for Prozac to help depression then, because it very weakly, very badly turns on neuroplasticity. In some people, if you're lucky, and Mars is in retrograde in Capricorn or whatever, it's a chance. There are other ways to turn on neuroplasticity that are amazingly powerful. Infrared light is one of those. We've talked about that. But the other is the anesthetic ketamine. Activates the growth factor in the adult brain. Growth factor is called brain-derived neurotrophic factor, or BDNF. My postdoctoral research, I had grants as a medical student and into residency. they were on these growth factors, BDNF and others. So I know BDNF very, very well. And when I first looked at ketamine and said, holy smokes, this is turning on BDNF.
Mhm.
We need to use it in a different way. We need to apply this in a different way. So, the kind of the standard way that people do ketamine therapy right now is you get 6 infusions over 2 weeks, 3 infusions first week, 3 infusions the next week. There's only one problem with that. An axon grows a millimeter a day. Neuroplasticity does not happen in 2 weeks.
Mhm.
Ketamine more than once a week. If I do it every 2 weeks, I get exactly the same benefit. 50% remission rate in our patients that we've treated with ketamine over 10 years. And those numbers have held steady. So, turning on neuroplasticity is key to treating depression and PTSD. So let's talk about the studies and the clinical work. So I've already talked about the depression study, and I've talked about our TBI study. So really, I'm going to talk about the clinical work here that we're doing. We were going to do a study with Harvard on PTSD, but then COVID hit, shut that down. But we had already treated a bunch of people with PTSD. And now, largely what I'm seeing are civilians with PTSD, although there's a veteran out there who needs treatment. We have a foundation that supports veterans and first responders. And we cover 50% of the cost of the treatment for veterans and first responders. So any of you guys and gals out there who are in those categories, we would love to help you, because that you guys service to the country and the community that nobody else can
Yeah,
really measure up to.
absolutely.
And the ship was floundering. And injury from that. And two, he had to pack the bodies in the cold rooms in the galley because there were so many by that. And he lived for helicopters, freaked him out because he was attacked. They were attacked by helicopters and jets. He came in on the 6th treatment. He says, "This is weird, doc. I saw the light." And I said, "So you mean you saw something flashing in your eyes?" Because we have little metal goggles over their eyes. I can show you. We've got a little video if you care to see that.
Yeah.
And he said, "No, it's like I saw the light in my brain." And from that moment on, his trauma symptoms were gone. 6 treatments. Now, we have civilians who have, PTSD from bad marriages and domestic abuse and car accidents and such. I've not gotten that gold star of 6 treatments, but 20 treatments, 30 treatments, that's pretty typical for folks to see a really vast improvement.
Yeah.
The other area that I think is fascinating, and currently there is no treatment, is long COVID.
Mhm.
So the people who have COVID and they have brain fog and memory problems and fatigue, and maybe they still have respiratory problems, we're treating those patients. And they're, going from not being able to get up a flight of stairs, not being able to work, to back hiking 14ers that I can see out my window here, and working full time. And a dentist from Florida came up here and got treated, and he had a tremor. This is not a good thing for a dentist.
Yeah.
And he had fatigue and brain fog. He couldn't, keep up. And he had lifetime diagnosis of ADHD as well. And he got 20 treatments. And around about treatment 14, he pulls me aside and says, "Doc, this is weird. When I take my Adderall, it makes me jittery now. So I stopped taking my Adderall, and I can focus just fine."
Mhm.
And so he got rid of the brain fog. He got rid of the fatigue. The tremor went away. And he doesn't have to take ADHD medicine anymore. So he taught me that, okay, we can really start pushing on, ADHD as well as something that is worth treating
Mhm.
with this modality and can be done safely. And we treated a smattering of kiddos who didn't tolerate the stimulants, and they improved. Their academics improved, and they were, still rambunctious kids, but they were able to focus and concentrate and do well in school.
Yeah.
He was able to cut his Sinemet dose, his medication dose, in half. He came back for a second treatment and he said, okay, after that, my cognition improved. My memory and cognition improved. And he's been stable. So, there's so much work that needs to be done. There's so much, and these are all observations at this point.
Right.
They're not studies. They're not double-blind, placebo-controlled clinical trials that have been replicated, that had sufficient N, as you say, sufficient power. All of that needs to be done. I'm the first to admit it.
Yeah. And how do you explain the positive benefits in ADHD? Because it's slightly different, right? As far as the brain's concerned when it comes to depression and PTSD, you can see overlap there. But with respect to ADHD, how do you explain the benefits there?
Great question. Great question. And I have no idea yet.
Mm.
I don't
Yeah.
know.
And you touched on the ketamine piece, and there's a lot of
Mhm.
research going into psychedelic assisted therapy in general and some of the neuroplasticity experience there. As far as neuroplasticity is concerned, you've obviously formed new neuronal connections and you're seeing things differently, which may shift your perspective. And again, you can see the benefit of that in PTSD or depression, where you may have a different outlook on life, or you may be struggling with a certain worldview, whatever that may be. So, how do you then, is that something that remains? Is that sustainable, or do you have to continue to repeat certain behaviors to ensure that those connections are getting stronger, and then you're following that path within your brain?
Mechanism that's sort of driving degeneration. In the case of PTSD, there probably is a genetic vulnerability to getting PTSD. Right after 9/11, people were giving out, putting patients on clonidine, which is a beta blocker. Well, technically it's an alpha 2 blocker. And also propranolol, which is a beta blocker. And they were looking at, could we reduce the severity or even the occurrence of PTSD in these people who had experienced this horrible trauma. And that data had some positive valence to it. It wasn't huge. It wasn't a huge benefit, but it does say that, okay, we can maybe physiologically interrupt this pathway that leads to PTSD for some people.
Mm.
But there is this vulnerability. And in the sense that what we've done with multi-watt infrared light therapy in traumatic brain injury is that we have found that patients who then go out and have a concussive event don't seem to have some decrease in how severe that concussion is. In other words, it may be protective for future concussive events based on what we're seeing from people's real life experiences.
And speaking of concussions, I think there's been a paradigm shift there as well, because for the longest time you were told that you just sit in, not stimulate yourself too much, sit in a darker room, not
Mm.
push yourself as far as exercise goes or activities go. I was talking to a colleague recently who experienced a concussion, and he was given the opposite advice now, because things are shifting, where it's no, you need to push yourself, see how far you can and
Mhm.
go, and set a new baseline every time. Is that fair? Is that what you're seeing as well? And why is this paradigm shift coming about now?
Yeah, and the other paradigm shift that happened in concussion was that it was fully recognized that this is a mild traumatic brain injury.
Mhm. Yes.
For the longest time, oh, yeah, it's just concussion, shake it off, blah, blah, blah. And I remember kind of trying to get the NFL to pay attention to this 18 years ago.
Mhm.
And now, they're fully on board. This is a traumatic brain injury. Now, in traumatic brain injury, there are several phases. The initial trauma, the physical trauma, but that sets off this sort of worrying and spinning production of excitatory neurotransmitters. So the glutamate is an excitatory transmitter. So this sort of glutamate wave that gets stirred up in response to a concussive is one of the reasons to, okay, keep things quiet, keep things calm, keep things dark for 24, 48 hours. But then, you want to start, doing everything you can to encourage neuroplasticity. The brain naturally makes this growth factor, BDNF. It naturally is capable of neuroplasticity, but absence additional stimulation like a multi-watt infrared light therapy or ketamine or potentially other things, it only does so much.
Yeah, no, I appreciate that. Now, with this infrared light therapy, you've talked about it's not as invasive, right? So if someone's seeking therapy, they have to relive a lot of these traumatic incidents, and that can be really difficult for a lot of people. And there's a lot of
Mm-hmm.
work going into finding these non-invasive ways of healing. Do you feel like
Mm-hmm.
this is a move in the right direction with respect to people working through some of these issues around depression and PTSD?
Yes, I really do. And the idea that you had to relive the trauma in order to heal from the trauma, there th- at some level that is true. Pick that day of that terrible car accident and let's just see where things go and just let the images go by, scenes outside of a train car. And so a lot of the times when I work on trauma, and I came into practice here in Denver right after Columbine. And so I had a lot of adolescents and young adults who had horrible PTSD from what happened at Columbine. And I never ever talked about the lunchroom. So that sort of taking it one step away from the trauma and working on the feelings, working on the messages that a person got from that experience. That's what's really healing. So whether you do that with psychedelic assisted psychotherapy, or you do that with ketamine assisted psychotherapy, you do that with therapy combined with infrared light therapy, you don't have to go through every bloody detail of this horrible experience, and you get the same healing.
Yeah, and the assisted therapy is the crucial piece there because I think a lot of people undermine that or underestimate the benefit of the assisted therapy part. Because how do you explain the neuroplasticity piece with ketamine and some of the psychedelics? Obviously, there's quite a few out there, but because the downside there, if it's not managed appropriately, is psychosis, which a lot of people have experienced over the years because they haven't been responsible with the dosage or the use or the setting,
Exactly.
whatever. So, yeah, so let's maybe, if you can, explain the positivity there with neuroplasticity, and then obviously the downside with the potential risk for psychosis.
Sure. It's all in here.
Yeah.
Brighter Days Ahead on Amazon. And really, what I dug into this whole idea of what is the dose of ketamine that really is going to be helpful. As I said, I've been running a ketamine clinic for 10 years. In 10 years, do you know how many patients have had a hallucination? One.
Mm.
One. Because you don't have to go up to those doses that cause hallucinations. That is a myth. A lot of practitioners believe that myth, but it is a myth, and it's a dangerous myth. Because what you really, ketamine is turning on neuroplasticity, and it can do it at doses that you can have a conversation through the entire infusion. You don't have to be gorked out. Um, and and my data proves that 72% response rate. That's better than the national average. The national average is 52. So we have a 72% response rate. And what the patients experience is, just sort of this nice, kind of relaxed, floaty trip. Maybe the music's more intense, but they're not hallucinating. So that's one of the things in Brighter Days Ahead has got a lot about patients' experiences. In the back of the book, I do what are called deep dives, and this is where the science is. So I go way into the molecular biology of how ketamine turns on BDNF and increases the receptors for BDNF and blah, 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 blah. All that sciencey stuff is in there. But you don't have to read that if you don't want to. But the point I really make here is that ketamine tells us, number one, the way we think about depression is wrong.
Mm-hmm.
And the way to treat depression with pills is completely wrong at this point. And that we have to fundamentally shift how we think about depression. Then I also talk about the fact that depression isn't one thing. For example, the brain SPECT scan work I do. We wrote a couple of papers pushing back against the American Psychiatric Association. And if you look at the diagnostic criteria for depression, you can be sleeping all the time or not sleeping at all. You can be eating all the time or not eating at all. You can be running around frenetically or laying on the floor, and you get the same diagnosis. That doesn't make any sense. And the brain scans of people look different. There are multiple types of scan results that we see with depression. And if you've got a traumatic brain injury, the chance that you're going to have depression is 5 times higher than the average person. And the last thing I'll say is there's a whole neglected area of medicine, which is the role of infections, such as chronic viral infections that cause depression, anxiety, chronic fatigue syndrome. I mean, I've had patients who came to me because they had seizure disorders and depression. And we put them on an antiviral, their depression goes away, and gosh darn it, they stopped having seizures as well. So a whole neglected field. Again, I'm out here breaking paradigms left and right.
Yeah, no, I appreciate that. One of the things you shared with me previously was with depression, the toxins are building up and the brain has its natural lymphatic system, which cleans itself. So if we're not sleeping properly, then we're not letting that mechanism where that whole toxin cleanup happens. So a lot of the time
Correct.
people will then there's an aspect of positivity around certain behaviors you partake in and that can stack themselves. And then you can do the opposite too, right? Where you perpetuate things in a backward direction. And I think that's what happens with some of these issues around depression too, is then your sleep starts deteriorating, which continues to build on itself. And then you're really behind the 8 ball there.
Correct. Yeah, so the lymphatic system, newly discovered about 8 years ago, clears toxins from the brain. And as you said, it works best during deep sleep, stage 4 sleep. And it's 4 times more active at stage 4 sleep than when we're awake. And if you're depressed, you don't sleep well. If you have PTSD, you don't sleep well. If you have TBI, you don't sleep well. If you have chronic fatigue syndrome, you don't sleep well. If you're getting mild cognitive impairment and dementia, you don't sleep well. It's done at a German facility, so I think we can maybe trust it a little bit. And it showed that certain wavelengths of infrared light, and including ones that we use, stimulate that lymphatic clearance. And they were looking at mice with Alzheimer's, genetically manipulated, so they build up amyloid in their brain. And the mice that were treated with infrared light cleared amyloid 5 times better than the mice that weren't treated. It's proven that's a big role in Alzheimer's disease and dementia. And so one of the things he says, in the book is, like, number one, you got to identify if there's infections and you got to clear them. That's called wet dementia. And he says, number two, you've got to stimulate the brain. You've got to get energy into the brain, i.e. infrared light. And number three, you've got to change your diet so that your insulin receptors become more responsive. And he is now, just a couple of years back, he published a book called, and get this, Survivors of Alzheimer's Disease. And he's putting this all together, in a different paradigm than what most medicine thinks about.
Right.
Most medicine says, oh, you're getting dementia, let's put you on Aricept and Namenda. And that helps a little bit.
Yeah.
But there's a whole another layer to this.
Yeah. Yeah. And what role does dopamine play in all of this? Because there's healthier forms of releasing dopamine, and then there's what I like to consider more manufactured ways of releasing dopamine. But yeah, if you were to focus on the healthier forms, whether it's like goal setting or exercise, what role does that dopamine release play?
Yeah.
Especially in depression.
That's a fantastic question. Yeah. So the bad ways of getting dopamine, alcohol, drugs, addictive behaviors, those all stimulate dopamine. Video games, or don't get me started. Um, but healthy ways, exercise, meditation, mindfulness. I have patients who've literally, gotten so good at meditating that we've been able to take them off anxiety medicines and depression medicines. My patients who have mild cognitive impairment, we get them meditating, and there's a clear benefit. Yeah, you're absolutely right. There's a clear benefit to getting healthier brain function going.
Mhm, mhm. And I guess a couple questions are coming back to the infrared light therapy. One, if individuals want some of the higher power exposure, how can they find products that would enable that? And then the second piece is potential downsides, right? So when I think exposure to light, there could be some risks, and maybe the research it's in the early stages, so we don't know that yet. You may need several years to see, but do you
Mhm.
see that as a potential? So two questions there. Yeah.
Let's answer the second one first.
Okay.
Yeah, so you're absolutely right. There are potential risks that we have not identified that could emerge over decades. We're still sorting that out with medications.
Yep.
Um, does amitriptyline cause dementia? The English say, oh well, statistically, if you look at millions of people, it does. Not all by it contributes to. But so I think that is an open question, and it's an important thing to always keep in mind, to be careful about. As far as working with higher power devices, this is an area that I'm actually very actively working on, because the higher power devices can be dangerous in the wrong hands. You had to understand the physics. You had to understand laser safety. These are capable of burning a hole through something if you maintain them on a single point for an extended period of time. That's bad. So it's these higher powered devices are really, they belong in the hands of clinicians who are trained appropriately. And I'm working on developing training programs so that clinicians can know how to do this correctly and safely. But right now, I'm not saying that the low power devices don't do anything.
Mhm.
They do something. You just have to keep doing it every day. And if that's worth it to you, I have colleagues who climb in a hyperbaric chamber every day,
Mhm.
and it's worth it to them.
Yeah.
So I think right now I would say these high powered devices belong in the hands of clinicians. Anybody who wants to get treated, our clinic is in Denver. I'm pushing to get a clinic out on the East Coast, but right now we're in Denver. And if you go to healmybrain.info or neuroluminance.com, you can look at the website and learn all about what we're doing. And
Mhm.
I provide free telephone consultations, 15-minute phone calls to say, what's going on? Can I help? And anybody who mentions your podcast, I will give a 25% discount on the first set of treatments.
Well, no, I appreciate that. We'll definitely put that in the show notes. So the website you said were healmybrain.info,
.info.
and what was the other one?
Neuroluminance.com. So that's NEURO hyphen LUMINANCE.com.
All right.
It's a
Yeah.
made up word.
Yeah, put that out there. Just one last question around
Sure.
exposure, and this is more for personal interest. When I've got the red light set up, does it need to be direct contact, like in terms of the light rays, or even if it's in the vicinity, is that good enough?
Air is absorbing that and scattering that infrared light. So the closer to your skin, the better with these low power devices. And in that article I mentioned in Frontiers in Neurology, I actually show that just a 3 centimeter gap is enough to reduce the amount of light by 50%. So remember those stupid spider things they had that they said that it was causing weight loss? It's inducing weight loss by breaking up your fat cells, and they're up, 3 feet above the patient, putting out half a watt. You know, I literally snuck a light meter in. I signed up to go do this because I wanted to,
Yeah.
actually test it. So I got the light meter and I'm, right up against the light and I'm back away. And I get to the point where it would be, up there and I'm down here. Light meter is picking up zero, nothing. This was all a bunch of hogwash. And that's what scares me about the field, this kind of charlatan behavior. That thing got on Dr. Oz, for crying out loud.
Yeah. No, I appreciate that, and it's good to know. Thank you so much, Dr.
Yeah.
Henderson. I really enjoyed this conversation. Very informative and educational for me, and I'm definitely sure the listeners will get a lot out of this too. But you've shared some of the ways people can find your work. Is there anything else you would like to add in terms of how listeners can find other parts of your work? I know you talked about the book as well. It's on Amazon. So yeah, just want to give you that opportunity to share with the listeners.
Yeah. If you look on my YouTube channel, there's a bunch of little short snippets about different topics like the glymphatic system and other things. So lots of opportunities to do some quick learning.
Oh, that's great. Thank you again.
Thank you for having me. It's a real pleasure.